Very good morning, everybody. Today's class will be on systemic fluorides. This is the only topic left in the topic of in the unit of fluorides. We have so far discussed the history, the mechanism of action, the metabolism, fluoride toxicity, both acute and chronic, defluoridation, and last class we have discussed about topical fluorides. Now, another method by which fluorides can be therapeutically used is the systemic delivery of fluorides, and that is what we'll be discussing today. So, just a quick recall of the mechanisms of action. Unlike topical fluorides, all the mechanisms of action of fluoride will be beneficial when we talk about systemic fluorides. The mechanism of action of fluorides include increased enamel resistance or reduced enamel solubility. The second is the increased rate of post-eruptive maturation of enamel. Third is remineralization of incipient lesions. Fourth is alteration in tooth morphology. And fifth is interference with plaque microorganisms. All these mechanisms act in systemic fluoride. So while the topical fluoride, the action was more localized to the tooth, here the fluoride is consumed, it is absorbed into the bloodstream, and it reaches the teeth via the saliva and the gingival follicular fluid. So all these mechanisms will be applicable when we talk about systemic fluorides. So there are different methods of delivery of systemic fluorides. The most common method and the most cost-effective method is water fluoridation. So under water fluoridation, there are two types. One is called the community water fluoridation. The next is school water fluoridation. So we'll start with water fluoridation. Water fluoridation is a controlled adjustment of fluoride in community water supply. So this is possible only if you have a centralized water supply. So when you have a centralized water supply, you can add on fluoride and then you can maintain the concentration at 1 parts per million. And the definition of fluoridation is upward adjustment of fluoride ion concentration in a public water supply in such a way that the concentration of fluoride in the water can be constantly maintained at 1 parts per million by weight to prevent dental caries with a minimum possibility of causing dental fluorosis. So this is what we have discussed earlier, that the WHO recommends the concentration of 0.7 to 1.2 ppm, and that varies depending on the temperature of that place. So on an average, you call it as 1 parts per million is the concentration of fluoride that is added to drinking water. And once this is done, many of the studies there have been, in fact, the therapeutic benefits of fluoride started with systemic fluoridation. So we have already talked about Grand Rapids Muskegon study and some other water fluoridation studies when we talked about history. So these are few of the important milestone studies which are done on knowing the therapeutic benefit of water fluoridation. The first artificially fluoridated water was at Grand Rapids, and that study is known as Grand Rapids Muskegon study in the year 1945, and it showed after 6 years it was seen that the caries experience of children at Grand Rapids was more than 50% less compared to Muskegon, where the fluoride was not added to drinking water. So similarly, you have other studies. Just know the name. The second study is called the Newburgh-Kingston study. Then you have the Evanston Oak Park study. Then you have Teal-Kulenberg study. Then Canadian study, New Zealand study, Australian study. All these are studies conducted throughout the world that time. And all of these studies proved that when fluoride is added at 1 parts per million in drinking water, the result is that there is a maximum reduction in caries with a minimum chance of causing dental fluorosis. So coming to the optimal levels of fluoride, this was already discussed. The optimum levels of fluoride is always mentioned as a range. It is 0.7 to 1.2. The reason why it is mentioned as a range is because it directly depends on how much of water is consumed. The more the water is consumed, less needs to be the concentration. So it depends on the temperature of that place. And there is a formula for calculating that. This is known as the Galligan's formula. So Galligan's formula, F is equal to 0.34 by E, where E is equal to minus 0.038 plus 0.0062 into temperature of the place in degree Fahrenheit. So when you substitute the temperature of the place in degree Fahrenheit, you get E. When you substitute E in the first formula, what you get is called the amount of fluoride to be added in parts per million. So what are the compounds used or the chemicals used for water fluoridation? The first is fluorospar. Fluorospar is calcium fluoride, and it is used when you have lot of consumption for mega plants. Fluorospar is used. The second is sodium fluoride. Sodium fluoride is a white odorless powder, and this is one of the we have discussed about sodium fluoride as topical fluoride as well in Knudsen's technique. We have already discussed. So similarly, sodium fluoride can be added, and the next is silicofluoride. Silicofluoride. Then the next is sodium silicofluoride, hydrofluorosilicic acid, and ammonium silicofluoride. So these are the various compounds that are added to water for achieving the community water fluoridation. So I repeat, it is fluorospar, sodium fluoride, silicofluoride, sodium silicofluoride, hydrofluorosilicic acid, and ammonium silicofluoride. So there are various equipments used to add water fluoridation, add fluoride to drinking water, and that depends on what is the output required and what is the material added. The first system is called as the saturator system. In saturator system, you use sodium fluoride, and 4% sodium fluoride is used. It is mainly used for small towns where you require less than 3.8 million liters per day. So this, what I'm going to talk about, is a centralized water supply. So when you have a population of less than say 3.8 million per day, liters per day is what is required, you use saturator system, and the reagent used here is 4% sodium fluoride. The next is dry feeder system. Here sodium fluoride or silicofluoride in the form of powder is used, and this is mainly for again medium sized towns which require more than 3.8 million liters per day. The third is called the solution feeder system. Here you use a volumetric pump. Here you use a solution, not a powder, that is hydrofluorosilicic acid, and this is used for large towns, medium sized to large sized towns which more than 7.6 million liters per day consumption. You use solution feeder system. The next is Venturi fluoridator system, and Venturi fluoridator system also uses sodium fluoride, and this is this system, there is no chance of accidental overdosing. So that is the biggest advantage of Venturi fluoridator system. The next is saturation suspension cone. This is also used for sodium fluoride, and these are various mechanisms by which, or various machines by which you can add fluoride artificially to drinking water. So just know the names, because once in university exam they've asked you what are the various systems of adding as a short note. So know the names and what are the reagents used under each type of mechanism. Now that is about water fluoridation. Other than water fluoridation, what are the other systemic methods of fluoride delivery? The next is fluoridated salt. You have fluoridated milk. Then you have school water fluoridation. Then you have school-based fluoride supplemental programs and school-based fluoride mouth rinse programs. These are the other mechanisms by which systemic fluoride is introduced to the body. So we'll talk about each one of them. The next is called salt fluoridation, and this concept is similar to what we have in India as iodized salt. Any salt that is available in India has to be compulsorily iodized. The main aim of this is to reduce the iodine deficiency disorders. So similar to this, you can also artificially fluoridate salt, and this can be used another alternative to water fluoridation, though it is not as cost effective as water fluoridation. Comparative to other methods, this is also quite cost effective. And this was started in Switzerland by a person called as Vespi. The amount of fluoride that is added ranges between 250 to 350 ppm. Now, what is the difference here? Water, you drink lots of water. Compared to that, the consumption of salt is very less. So you require around 250 to 350 parts per million is the concentration that is recommended in salt fluoridation. And for salt fluoridation, the chemicals used are either sodium fluoride or calcium fluoride, and these are the usual reagents used for fluoridating salt. The advantage of salt fluoridation is, like we already have time-tested iodized salt available. On the similar lines, it can be done. It can include, because everybody uses salt, it can reach wider populations, and it does not require any specific behavioral change because salt is a part of everybody's diet. It is economical, and it allows consumer free choice. Means if a person does not want a fluoridated salt, he can take it, he or she can buy it accordingly. So there is always a choice for the customer, unlike the centralized water supply. So this is the basic advantage of this. Whereas difficulty is mainly in people who consume less salt, especially children below 2 years or people who are having hypertension. This effect of fluoride doesn't come there because salt consumption is mainly required during the time teeth are developing. So when children are less than 2 years, usually the salt intake is less. The third is called milk fluoridation, where you are fluoridating the milk. The usual concentration recommended is 80 parts per million, and the target population here is children again because they are that is the population which consumes maximum amount of milk. But problem with milk fluoridation is that milk fluoridation becomes costly compared to salt and water. It is very much costly, not affordable by everybody. So that is the major disadvantage. Whereas another difference between milk fluoridation and other systemic fluorides is that in milk fluoridation you never use sodium fluoride because it reacts with milk to form calcium fluoride, and hence what you use is always sodium monofluorophosphate. This is the same content which is there in the toothpaste. So it is not sodium fluoride. Remember, what is added to milk is sodium monofluorophosphate at a concentration of 80 parts per million. The next is school water fluoridation. This is another type of water fluoridation like your community water fluoridation. You have school water fluoridation wherein the source of drinking water in the schools is artificially fluoridated. And because children spend less time in school compared to home, the concentration recommended is 4.5 ppm. Unlike 1 ppm for community water supply, here what is recommended as 4.5 ppm. The main reason is because children spend less time in school, and this becomes a success only when all children consumed water from that source itself. If the children get water from their homes, this is not going to be of use. So if you are artificially fluoridating the water supply of a school, it should ensure that all children consume water from that source itself. The recommended concentration is 4.5 ppm. The next is school-based fluoride supplemental programs. One supplement that is recommended is your 2.2 milligram sodium fluoride, and this is available as 2.2 milligrams and 1.1 milligrams. 2.2 milligrams contain 1 milligram of fluoride and 1.1 contains 0.5 milligrams of fluoride. So depending on the age group, this tablet is children are asked to chew the tablet, and chewing the tablet for 30 seconds and swishing, it gives it a topical effect, and after that they are asked to swallow so that it gives a systemic effect. So this is a combined topical and systemic where the children are asked to chew the tablet and then swallow. And the last is school-based fluoride mouth rinse program. So here over-the-counter available sodium fluoride mouthwashes are given at two concentrations, 230 ppm if it is used daily and 900 ppm if it is used weekly. So for daily rinse you give 230 parts per million, and weekly rinse you give 900 parts per million. And for kindergarten children it is usually 5 ml for 30 seconds, and for older children it is 10 ml for 60 seconds. So the concentration of fluoride in 230 ppm is 0.05% of sodium fluoride, which is equivalent to 0.02% of fluoride. So similarly, in 900 ppm you have 0.2% of sodium fluoride, which is equivalent to 0.09% of fluoride. So this is another mouth rinse program. So after mouth rinsing, the children are asked to drink it so that it is both topical as well as systemic. So these are the methods of systemic fluoride delivery. So regarding its feasibility in India, water fluoridation is not very much feasible because in India we don't have a centralized water supply. Hence it is not feasible only when there is a centralized water supply, because in India we know the source of drinking water are different. People drink from wells, from bore wells, from canals, from lakes. These are all different sources, so you cannot practically fluoridate all these sources. That is the major drawback of feasibility of water fluoridation in India is not appropriate. Salt fluoridation can be implemented like on the lines of iodized salt. Then school water fluoridation can also be recommended. And one thing we should bear in mind in relation to all this is in India there are a lot of states where there is fluorosis. So all this should be according to the local fluoride level in the drinking water. Things have to be adjusted. Of course, fluoride mouth rinse or tablets can also be feasible. So that by this we come to the end of the chapter called fluorides as well as systemic fluoridation. Thank you.